Nearly everybody who's been treated with stimulant medication has experienced some form of shaming from friends, family members, random people on the internet, even doctors and pharmacists. Let's take a second to analyze the myths and facts of ADHD medication. Myth number 1. ADHD medications such as Adderall are just like methamphetamine. It's even in the name. Adderall's generic name is called amphetamine salts. This myth is my absolute favorite. You see, I spent years of my life believing this one. But is it true? Not even close. That whole methamphetamine versus amphetamine thing, well, that meth prefix changes a lot at the chemical level. All stimulant medications used to treat ADHD act by producing more of a chemical in your brain called dopamine. Dopamine is responsible for focus, memory, sleep regulation, motivation, arousal, happiness, and so many more functions within the brain. Dopamine's role in happiness is why you get super happy when you have a large release of the neurotransmitter. This is why people who use methamphetamine report such a euphoric feeling. In contrast, people with ADHD have too little dopamine within their brain. Maybe that's why there's such a high association rate between ADHD, depression, and marijuana overuse. Marijuana could be compensating for the ADHD person's lowered dopamine, but more on this in a different video. This is where amphetamines step in. They produce more dopamine to bring your levels back to a normal amount. People who are using methamphetamine are getting their brain to produce so much dopamine that it's way more than they need, leading to feelings of euphoria and addiction. In fact, amphetamines release 1/5 of the amount of dopamine that methamphetamine does. This is a drastic difference, so much so that a typical person with ADHD wouldn't feel any euphoria at all on their proper dose. However, misuse of amphetamines, typically done via either smoking it or snorting it, has a drastically higher rate of addiction. Nearly 11% of people who use amphetamines for non-medical purposes develop an addiction to the substance. Second myth, stimulants change your brain just like methamphetamine does. I love myths that are so far out of touch with reality that scientific articles like these make it apparent that they're just plain wrong. In fact, they're so wrong that it has been found that white matter within the brain actually increased when study participants were treated with stimulants. White matter is responsible for the essential connectivity within the brain, indicating that the use of stimulants led to increased brain connectivity. Stimulant use has also been linked to an increase in glutamate, which positively affected the study participants' learning, memory, and emotions. Stimulants have also been shown to increase activation in the regions of the brain that are underdeveloped in people with ADHD. Stimulants have been shown to positively affect your learning, memory, emotions, white matter, and even the structure and function of the regions of the brain associated with ADHD. Not quite what I was told ADHD medication does to my brain as a kid. The new class of drugs for ADHD aren't even stimulants. That is, they don't directly work to increase dopamine. Instead, they work on another neurotransmitter called norepinephrine. Third myth, you'll get addicted to ADHD medication. I see where this myth comes from. You know that methamphetamine is ridiculously addictive, and so amphetamines must be as well, right? Wrong. Taking stimulants was found to reduce the risk for cigarette smoking and substance abuse disorders in adolescents with ADHD. Matter of fact, simply having ADHD puts you at an increased risk of having a substance use disorder. Myth number 4. Psychological or behavior therapy should always be tried before medication. The problem with trying talk or behavior therapy before medication is that medication works much better. The multimodal treatment of ADHD study examined this issue in ADHD children using several academic medical centers in the United States. They found that treating ADHD with medication was better than treating it with behavior therapy. One of the most interesting findings in the multimodal treatment of ADHD study was that behavior therapy plus medication was found to be more effective than just medication alone. That's why treatment guidelines from the American Academy of Pediatrics and the American Academy of Child and Adolescent recommend medicine as a first-line treatment for ADHD. However, keep in mind that the right choice for you is a personal decision, not one based on the stigma around you. If one thing should be apparent to you by this point, it's that not everything that people say about something is based in fact. Trust validated, peer-reviewed research to make your decisions. Don't trust that your stepdad knows what he's talking about. Stimulants aren't the right choice for everyone with ADHD. But if you're letting social stigma control your choices rather than using the scientific data around you, you are hurting yourself. If there's anything that you take away from this video, please remember that having ADHD can be treated with medications that actually work. But social stigma can easily stand in the way if you let it. Let's end the social stigma that ADHD medication has surrounding it by educating the people around us. If you liked the video, share it so that we can end this stigma through education.